Hi everyone, Dawn White here at Landscape Animal Hospital and Mechanicsburg. We are joined again by the star. This is Mechanicsburg Borough Police Department Canine Mark, and here is his veterinarian, Dr. Jennifer Todd. So thanks for joining us.
Sure.
So if you want to tell us a little bit about Mark's treatment, how you diagnosed him, and where he goes from here.
So Mark tested positive on one of our in-clinic tests. We have the ability to run an immediate Lyme test in the hospital. And as dogs test positive, they are testing positive for the antibody to Lyme disease. Lyme disease is caused by a bacteria which is passed to dogs through the deer tick. And once a dog tests positive, many dogs do not yet have clinical signs or symptoms. We will talk about treatment for Lyme disease, which is very similar to treatment for Lyme disease in humans. It is a course of an antibiotic called doxycycline. That's the most commonly used antibiotic. We do that course of treatment for 28 days. And the reason that we do treat dogs, even if they're not having current symptoms, is we would like to not have them develop chronic disease. Lyme disease in dogs can cause joint pain and swelling. Over time, it can cause destruction of the joint and Lyme arthritis. It can also cause fatal kidney disease and kidney failure if that Lyme bacteria decides to settle in the kidneys themselves. In rare cases, we do see some neurologic signs like meningitis or encephalitis type of things in dogs with Lyme disease.
And then any other symptoms that dog owners should watch out for?
Many symptoms may not be apparent to their owners. We can have a very short-lived 24-hour low-grade fever or 24-hour lethargy, or just them being a little bit more listless, and sometimes we miss that. Dogs don't really complain, so we may miss those little early signs of infection, which is why we're so aggressive with our screening. Every single year, every single dog, if we can, we'd like to aggressively screen for Lyme disease because we live in an endemic area.
And how would you do that? What should owners ask for when they go to the vet?
You would ask for a Lyme / tick disease test because many of our deer ticks here are co-infected with other diseases. So it's very common. All veterinary hospitals have them now, and because again we live in such an endemic area, this is routine. But just ask to make sure that you're currently tested yearly for tick diseases.
And talking about prevention now, you have some samples here of different things. So what would you recommend that owners do to prevent Lyme disease?
So prevention is really key. We want to not find positive dogs. Many different types of prevention. The Companion Animal Parasite Council recommends year-round prevention. We have products like I use in my dogs called NexGard. It's a once-a-month oral chewable tablet that prevents tick-borne diseases by killing ticks that carry Lyme disease. You can also use the topicals, which stay in the fatty layer under their skin and do not go systemic. Frontline Gold or Canine Advantix. There's another product called Seresto Collar that is also another option for people. But the key is year-round prevention.
And we have a map down here with some numbers on it. What is this?
This is the current year-to-date 2018 incidence of Lyme disease by the Companion Animal Parasite Council. So you can see this is a map of Pennsylvania. So far this year, a little over 200,000 dogs have been tested. A little over 26,000 dogs have tested positive. So of the dogs tested, almost 13% of dogs tested positive for Lyme disease. I believe the incidence is much higher than that because not all dogs are tested. Probably close to 20% of our dogs here are infected with Lyme disease or another tick disease. We estimate through current studies about 50% of our deer ticks in our area are carrying Lyme disease and other tick-borne diseases.
And underneath this, you have some more maps showing some counties in central Pennsylvania.
So this is by county. This is Cumberland County. So far this year to date, 5,800 dogs tested, 445 positive cases this far. Again, everyone is asked to report their positive cases. This is again, there are many counties that don't report, or many veterinarians that don't report. So this is really probably a very low estimate of the actual number.
And then over here you have a card. So what is this?
This is a little visual aid that we like to give to clients. This is a little tick spoon that helps people remove ticks from their dog if they find them. We like people not to be touching the ticks. So this little tick spoon helps them get the tick off safely. And this is a little incidence map overlaid by the different life stages and approximate sizes of the deer ticks. This is a larva, little tiny pinpoint there, a nymph, an adult male, and an adult unfed female. So I think it's really important that people realize the size of a deer tick and know that we can easily miss something this size on dogs that have hair all over their bodies. They only feed for 24 to 48 hours before they get full and drop off, and that's about how long it takes to transmit Lyme disease. So if you miss that tiny little tick in that amount of time, you've missed the exposure.
So if people see this and they're interested in getting some of these products for their dog, would they talk to their vets?
Exactly. We'll be glad. It's a lot of what we do is we talk about Lyme disease, we talk about prevention. There's other ways to prevent as well. The Lyme vaccinations are very safe and extremely effective. I like to use an analogy that I didn't make up, but we like to use dual prevention. So we like to use a tick prevention like the ones we discussed. We also like to vaccinate. I compare it to having an airbag and a seatbelt in the car for safety.
Mm-hmm. And with Mark, it was through a blood test,
exactly.
Correct? That you diagnosed him?
Routine blood tests every year.
And when he tested positive, what treatment did you put him on?
We first of all, we checked some other blood work to make sure that it hadn't affected his kidneys, and we put him on a course of 28 days of doxycycline antibiotic.
And for a dog like Mark over here, he's pretty young, he's 3 years old. What would the prognosis be for a dog with Lyme? I know his has gone dormant, kind of.
So as much as we can tell, we hope to find and treat these cases early so that they don't become chronic like many people have dealt with. We like to believe that we are very effective at treating Lyme disease. Again, we test many dogs who are positive and no symptoms. We treat them so that they don't develop chronic disease. So he has very good prognosis.
Okay, well thanks very much, Doctor, for joining us and telling some pet parents out there ways to protect their dogs. And I hear a little noise down here. Mark has a toy that he likes a lot. Looks like a pig.
Something like that. It's purple.
Yeah, so Mark is doing well. Thanks for joining us.